Hello, good evening. My name is Faith. I thank you for watching my videos. I welcome you even in today's video. Today we are going to talk about medicine administration and handling. Actually, this is a very wide topic, but I'm going to try and give a few that I'll manage to give because it's very wide. As I told you that I'm a nurse and I've been trained to give medicine, so it is that every nurse is trained to give medicine. So we are going to talk about medicine administration and all that goes with it. Okay, so we have 7 rules that govern medicine administration. The first one is that the person giving the medicine must be qualified and must have the permission to give the medicine. Must be a nurse, that's what I should say. So not everybody gives medicine, but the right person that has the authority, that they have the permission to give medicine, that's the only person that should give medicine according to our profession. Secondly, you have to give the medicine to the right patient. If you give medicine to a wrong person, that's a problem, and that can cost you even your job, because if you give medicine to a wrong person and it brings wrong bad effects, after effects, then that is very serious. So you have to make sure that you give medicine to the right patient. You have to be careful, so you don't have to rush as you give medicine. You have to cross check and make sure that this is Faith's medicine and I'm giving it to Faith. Actually, it may not even be, you don't just cross check that it is Faith as Faith's name. Check everything, check Faith who and the date of birth, just to make sure that this medicine is for real Faith. Okay, so and then you have to give the right medicine. So you just don't give any medicine that you find around. So maybe you went to the client's box of medicine and you find medicine and you just give the right medicine. I'm sorry, I'm talking like I'm being a little bit strict, but we are learning. I'm going to try to be a little bit soft. Okay, give the right medicine. Read the medicine card before you give the medicine, so that you know the right medicine that you are going to give and the right measurements, things like that. Okay, so we have dose. The medicine is measured in doses. You must make sure that you give the right dose of medicine. We get it from the medicine card. Okay, please before you give medicine, read carefully the medicine card and then give the right doses of medicine. Yeah, we give medicine at the right time. All medicine has time. You don't just give medicine at any time that you feel like. No, follow the time that has been given to you and give the medicine at the right time. Some medicine are very like you have to give it at a very specific time. It is very important that you give it at a specific time. So you have to follow time as you give medicine. You have to give it in the right way. that's why it's important to read the medicine card, because it will tell you that this tablet is given through the mouth, or this medicine is given like this. We also have the 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 leaflet that is found in the packaging of the medicine. If you don't have the medicine card, you can refer to the leaflet and you know how you're going to give the medicine. So you give the medicine the right way. You don't get medicine that is supposed to be given through another way and give it in another way. So the medicine is not going to be effective and it may even cause damage. Okay. So yeah, and then another issue, another rule is you give the medicine in the right place. And for example, if you're supposed to put the medicine in the eyes, put it in the eyes. Or if the medicine is supposed to go in the ears, put it in the ears. Or in the skin, on the skin, sorry, put it on the skin. So you have to be very, very careful to know where am I putting this medicine, not anyhow. For example, there is medicine that we give, maybe for example, medicine that's supposed to go under the tongue like this, and it's for just it melts under the tongue. If you just give it with water, it's not going to be as effective as it should have been. So that is the reason why we have to know where we put the medicine, and which place are we administering the medicine. Yeah, I think those are the rules, the 7 rules that we have to follow as we give medicine. If there's something that I have forgotten, please write down below and ask me. I will definitely come back and rectify or and correct or and give more information. I'm being careful because this is a very sensitive topic and it concerns medicine. Okay, we are done with that. So we are going to talk about medicine storage. How do we store medicine? First of all, we don't just leave medicine anyhow. We don't store medicine anyhow. Medicine is stored in a specific drawer or in a specific room, and that room, only people who have authority, who have been assigned to that room can go to that room, not anybody. And those people, they have keys. They keep that room or drawer or box locked, just to avoid accidents or misuse of what? Of medicine. So that is very important, that medicine is stored in the right place, in the right drawer, and then it is kept like locked. It's always locked. We open it only when we are supposed to open it. Medicine is stored under room temperature, and the room temperature is 25 degrees centigrade. So you don't put medicine anywhere, for example, where there is water, or it is too cold, or it is too hot, and then you store their medicine. So you have to make sure it's room temperature. It cannot go like beyond 25 degrees centigrade. That's not recommended. Okay. And then there is medicine that we store in the fridge. Also, the fridge has to be monitored. The recommended coldness or temperature that is supposed to be in the fridge, it is 6 degrees centigrade. So you have to always check and see that is the fridge still under the recommended temperature, or has it changed? Yeah, that's it about storage. Okay, another thing, when you give medicine, you're supposed to document it. Whenever you give medicine, if you have given one tablet, write that I have given one tablet to faint at this time and sign it. It is a regulation. It's mandatory actually. You have to register every medicine that you give. Yeah. Okay. And we also have this kind of medicine. It's called narcotic medicine. And another one, it is if you see medicine that has a red triangle on it, that kind of medicine, it has some like more sedatives. So you have to be careful with that kind of medicine. And we record it actually differently. They have their different places where we place books or records where we record that medicine. And you have to give accountability when you give that kind of medicine, because it contains like opium or something like that. Okay, so you have to be careful with that kind of medicine. Okay, when you give medicine to a wrong person, what do you do? It's called medicine deviate. When medicine deviate happens, what do? You report. You have to inform the supervisor in charge, or the nurse in charge, that we have had a problem, we have medicine deviation. That is, if you have given medicine to a wrong person, or you have given wrong medicine. Okay, and more to that, if you like, we call it medicine, like if you give, if medicine becomes poison, what do? You, for example, if you give more medicine to somebody, and you discover that this medicine has, that you have given more medicine that more than that is supposed to be given, you also have to report it. It is very important to report it, because this medicine can cause danger in somebody's life. So that is the reason that you have to report it. So on another issue, if you give medicine, you have to monitor the effects. All nurses, they monitor the effects of medicine, the after effects. Yes, I've given this medicine to Faith, but how has Faith reacted to this medicine? You check in the morning, you check in the afternoon, and check in the evening. And if there is nothing, then that's good. If there has been a reaction, then we report it and see why, and we take action. That is the reason that we monitor the medicine reactions, medicine effect, and that is very important. I also wanted to tell you about the different types of medicine, different forms of medicine that we administer. We have tablets like paracetamol. Everybody has ever taken paracetamol, so we have tablets. And we also have liquid. We give medicine in liquid form. I guess everybody has taken, for example, cough tablets. Cough syrup. So cough syrup is one of the forms of liquid medicine that we administer. We also have plasters. These plasters, they have, you may not know, but they have medicine inside it, and they're normally for pain and other things. So we put them on the skin, and medicine goes through the skin, and then it's just reacting or acting on or treating. So yeah, plasters also, we also give medicine through plasters. So we also have injections. Yes, everybody has ever seen or has ever had medicine given to them through injections. And we also have cream. Sometimes it can be cream that they put on the skin, and you don't know that it's medicine, but it's medicine. For us, we know that it's medicine. It's maybe it's treating rash, or with this eye drops that are in a cream form. So we put like in the eyes, but they are in a cream form. Yes, that's another form of medicine that we administer. And we also have or know of other types of medicine that are traditional. They are like leaves, food, and also in trees. So we also we know that they exist. We don't normally give that kind of medicine, but we know that that kind of medicine exists. The ways we give medicine. We give medicine through the mouth. The mouth, by taking like this through your mouth. We also give medicine through our behind. There is that kind of medicine that we give through the behind. I just want you to know that. I will not go very deep. Medicine is a very wide topic. So if you are an aspiring nurse or anybody that wants to work with medicine in medicine field, you will know more about it. But I'm just going to give you that. So we give medicine through skin. We put medicine on the skin. Just like I've said, like through creams and plasters. Yeah. And we also give medicine under the skin. For example, insulin, we put it under the skin. Yeah. And we also give medicine through blood vessels. So blood vessels, actually, that's the safest and the best way of giving medicine. Best, safest and fastest way of administering medicine. Hope everybody has heard that. We also give medicine through, like, for example, eyes or ears. yeah, things like that. What have I forgotten? Okay. There. When you go to buy medicine, there is this. You may know a name. Maybe this medicine is called Panadol, but Panadol, it may be in another country and it's called another name, but we don't normally look at that name that you say Panadol. There is something that generalizes medicine because different companies manufacture medicine. There is what we call active substance. That's the most important when you're going to buy medicine. For example, in Panadol, there is paracetamol. Paracetamol, that's what you look for when you go in any country and you want a painkiller called Panadol in your country. So when you go to you look in the pharmacy, you look at that active substance is called, it's always in small letters down there. There's this big letter called Panadol or Fancida or something. So, but below that, there is that active substance that you always have to look for. That is the medicine, that is the drug that you are always looking for. Any medicine that you want to buy, always look for that, and that is very important. Also, look at the packaging. Before you give medicine, look at the packaging of the medicine. You see how many grams does this medicine have or contain, how many tablets, and who is the manufacturer, and what is the expiry date. All those kind of things, we put them into consideration. By the way, expiry date is very important, and you also have to look at it. And with that, we've come to the end of today's topic. If I've left something out, please just go ahead and ask me, and I'll be able to answer it, because I've studied it and I know, and I'll continue making more research on it. But I think I have everything, and I've given a brief knowledge about medicine. I think this topic will help many people on how to give medicine and what they expect when they are going to give medicine. With this, I wish you the best, and please, I request you to like, comment, and subscribe on my channel. I love you, and see you next time. Bye.